My name is Emily Doria from the University of Pittsburgh. Thank you for the opportunity to share results from the pilot phase of our National Institute on Drug Abuse funded Project Kinship. Roughly 19% of all new HIV diagnoses are among women in the United States, with Black and Hispanic and Latina women comprising a disproportionate number of new diagnoses. The syndemic risks for incarceration and HIV acquisition are strongly correlated as a result of factors at the structural level, like community deprivation and racism, and the individual level, like substance use and other high-risk behaviors. Mirroring national HIV trends, there is disproportionate representation of Black and Brown women in the carceral system in the United States. Despite PrEP being efficacious for women, PrEP uptake among women is low, and the proportion of PrEP initiation in this population has declined in recent years. Women involved in the carceral system experience stigma and discrimination based on their substance use and sexual risk profiles, their carceral system involvement, and their racial and ethnic and gender identities. Despite being 3 decades into the HIV epidemic, stigma continues to impede HIV prevention efforts. And so this study uses an intersectionality enhanced consolidated framework for implementation research to analyze data collected from the pilot phase of a study aimed at developing and implementing a peer-led PrEP linkage navigation intervention designed to address intersectional stigma as a healthcare barrier for women involved in the carceral system. We conducted individual interviews with 10 women with recent involvement in the carceral system and stakeholders from the carceral and public health systems. Interviews were conducted telephonically and lasted between 45 and 60 minutes. Interviews explored participants' perspectives on the proposed content structure and delivery of a peer-led 5-session, 30-day kinship model to be implemented with women under community supervision. These sessions ranged from 45 to 75 minutes and focused on relationship building, needs assessment, stigma and health, HIV and PrEP education, and PrEP goal setting. Data in this study were analyzed using this intersectionality enhanced consolidated framework for implementation research, which provides a menu of constructs that can guide the systematic assessment of the barriers and facilitators to intervention implementation with an eye towards considering intersectionality. Factors in the outer setting aligned with patient needs and resources, including that to be successful, the intervention should be compatible by addressing experiences of discrimination related to women's intersecting stigmatized identities, so those related to their gender, race, carceral system involvement, and substance use, without re-traumatizing them. Specifically, activities most interesting were those that approach this content from a resiliency perspective that focused on building self-esteem, identifying and challenging stigmatizing statements, and developing assertiveness skills. Legal requirements were also mentioned as a barrier to engagement in the program, and therefore participants suggested that enrollment should meet legal requirements for the conditions of their community supervision. External policies were also identified, most notably that kinship should expand recruitment procedures to include women in jail, given that COVID related public health regulations shifted contact procedures for the community supervision model. To address the implementation climate of the inner setting and to maximize compatibility and access to knowledge and information, sessions were noted that they should be brief, flexibly ordered, and offer an opportunity for social support from other women program participants. For successful implementation, inner setting characteristics should be addressed by leveraging existing points of assistant contact to ensure outreach to women most interested and in need of PrEP linkage, so those detained in jail. In conclusion, participants were optimistic about Project Kinship because it addressed gaps in existing PrEP services and it addressed intersectional stigma as a unique barrier to healthcare engagement for this group of women. Results informed the revision of the kinship model for testing in an ongoing pilot trial with 75 women involved in the carceral system, and you can see aspects of that model captured here. Several specific changes were made to the kinship structure, including that sessions are tailored to participant needs, no sessions were longer than 45 minutes, that there were social events and opportunity for drop-in points of contact with the navigator, and that content addressing stigma and discrimination was tailored to the unique experiences of this group of women. Thanks so much for listening to my presentation today.